For this health check, we're continuing our conversation about protecting our heart health. Joining us in studio tonight is cardiologist Dr. David Gnegy to tell us more about protecting our heart health. Dr. Gnegy, thank you so much for joining us again.
Nice to be back.
Of course, it's a pleasure to have you again. You shared a lot of knowledge with us last time, and we're going to need even more of that knowledge tonight. So let's get right into it. The first thing that I do want to ask you is, what are some of the simplest but most powerful steps that people can take to protect, their heart health in their daily lives every day?
One of the simplest things is healthy lifestyle. And we covered this a little bit last week, but no smoking, healthy eating, exercise, pay attention to your symptoms if you have any, and if you have a strong family history, talk to your doctor about the preventive measures that you may need to take to keep from developing coronary disease early in life.
Right, and you mentioned that family history. That's kind of where I was looking to go next with my next question. I want to ask too, are there any extra steps besides maybe just talking to your doctor about those preventative steps? Is there something else that you can maybe do first?
Well, if we look at what we call first-degree relatives, and so that's
right.
Mom, dad, brothers, or sisters. If they've had early coronary disease in their 50s or even younger, really need to be on top of things. So that's the healthy lifestyle. Getting your cholesterol checked.
Right.
I know there's lots of, the Rotary, for example, does a clinic a couple times a year where you can get inexpensive blood work. Take advantage of things like that.
Right.
So you don't even have to go to your doctor to do that. And then if you have a family history and your LDLs are high, that's going to drive, then you talk to your doctor and say, hey, what do we do about this? I've tried diet, I've tried exercise,
right.
The numbers are still high. Do I need a drug? There's another test that sometimes we do, it's a calcium scoring. It's a quick, simple CT that looks for calcium in the coronary arteries. That tells us if we're at an increased risk for developing coronary disease and may drive us to do further testing or be the incentive to have a healthier lifestyle. I've had multiple patients that have had a calcium score done and it's elevated, and I will work on quitting smoking.
Right.
I'll get my cholesterol down.
And so I want to turn our attention now. You talked a lot about earlier last week and also earlier tonight as well about the healthy diet, heart healthy, getting exercise and stuff like that. Obviously that helps right now, but what does that impact for you long term for your, heart health?
So it's immense. The long-term benefits of continuing that lifestyle is going to put off, hopefully permanently, or maybe instead of developing coronary disease in your 50s and 60s, 70s and 80s. Plus, healthy eating, exercise, not smoking benefits all aspects of our health, mental and physical ability, mobility, and everything like that as we age.
Absolutely. And so now I want to turn our attention to some of the advancements in treatment, detection, and medication.
Sure.
How has that helped advance this field even further, trying to help these people with their heart health and being able to, probably a lot easier for you to kind of find these things and help people with their health?
Yeah. So I mentioned the calcium scoring, which was a CT. We also have coronary CTA, which typically we'd have to go to the cath lab, do a heart catheterization, which is an invasive procedure to look at the coronaries. We now have the technology to do a special type of CTA that look at the coronary arteries to see blockages that doesn't involve an overnight stay in the hospital
wonderful.
Or an invasive procedure. We also have cardiac MRIs that look at the heart in terms of function and in possibly infiltrative diseases and in looking at the valves. Those are all wonderful advances. The advances in the cath lab, every couple months we have new stents, new procedures. Years ago, you might have to have your valve, your chest open to have your valve replaced. Now we can do that by going in through the groin and replacing one of your heart valves, which gets people in and out of the hospital much quicker. So the person that may have not been able to have a valve surgery because of their age and other problems now can get a valve done and spend the night in the hospital and go home the next day. So the progress that we make in medicine changes month to month,
Absolutely.
year to year, and it's changed in my 30 plus years immensely.
Absolutely, and that's the wonderful thing. I mean, you were kind of there earlier on when there weren't these kinds of technologies and advancements, and you've gotten to see the growth too. So I'm sure for you being in the field for, you said 30 plus years, it must just be a lot easier, but also amazing to see the growth that you're seeing.
Yes, I mean, one of the big things is heart failure, which used to be, when I started, just a horrible diagnosis
Right.
to receive. And now, with all the great medications that we have people living regular lives. And we have the AICDs and biventricular devices to help improve the heart function, which has changed people's lives, prolonged lives, and the quality of life, which is what we're here to do.
Absolutely, that's the most important thing, improving that quality of life for your patients. Now, to wrap up our health check here over the 2 weeks, what would be, in your eyes, the most single important message, if you could share with our viewers right now, about heart health and keeping yourself safe and protecting yourself?
So one of the most important things is, and I see this every day, don't ignore symptoms if you have them.
Right.
If you have chest discomfort, even if you think it's silly, get it checked out. I'd rather have you get sent home from the ER saying you have an upset stomach versus someone sitting at home and having a heart attack.
Right.
So pay attention to your symptoms and take care of yourself. There's only one of you, and you gotta eat right, don't smoke, exercise. Those are the big important things to do, to take care of yourself. And support your loved ones too. If they are having symptoms or if they're a smoker, help them quit and help them seek medical care if they need it.
Absolutely. Well, Dr. Gnegy, I think you crushed it right there with a great ending, a beautiful point to make and share with our viewers, a wonderful message. Thank you so much for your time and your wealth of knowledge on this topic.
Thank you.
Of course. When we return Mid-Ohio Valley, we'll have one last look at the weather. Stay with us.